Namaskar, everybody. Welcome. Welcome to episode 2 of Living Forward. Namaskar, namaskar, namaskar. Welcome this Sunday morning to the second episode of Living Forward. I'm joined by Dr. Uma Aysola, Head Alliances and Partnerships, Access Health International. More importantly, she will be speaking to us about the role of health in life moving forward. Thank you so much for joining us on a Sunday morning, very early somewhere, not so early someplace else, late night someplace else. So here we go. Namaskar, namaskar, namaskar. Very good morning to all of you who are tuned in from India. Good evening, or late night somewhere else. What else? Some other variation of that. So today we are here for the second episode of Living Forward. And I have with me my dear friend Uma Aysola. And what's very interesting is that she is the convener of the Convenor Wellbeing of Indian Women's Network, Telangana. She's the head Alliances and Partnerships, Access Health International. And she's an independent director on boards. But most importantly, she's here because she's a person who works in the space of health. And not only is she working in that, she has deep passion for it. And I thought that this is, as we, in our show, Living Forward, we are looking at what is it that we have to put in place as we live forward into this future. And today we have Uma Aysola, who's going to share with us what's going to happen to the workspace, what's going to happen to life itself. How will it be if health now plays a role which probably it never did, at least overtly in our lives? So let's discover. And I'm taking this opportunity to welcome my friend Uma. Just to let you know, this is a make-believe coffee shop. So I'm just having some coffee, but it's not from a coffee shop. Swagat hai, Uma.
Swagat hai. This is the new greeting, and I'm going to start with that because the contact greetings are no longer welcome. It starts with the namaste. The namaste. And it's now globally accepted form of greeting, the way we are right now.
Yes.
So Ashish, it's a privilege to be on this show. And it's a privilege to actually talk about the changing times in health. We are a generation that have seen the best of times. And we have actually been where the next generation will not be, or the previous generation have not been. So if you look at it, today's children don't know whether they're going to school. And the previous generation didn't have the luxury of going to school because there was war or they were fighting poverty or otherwise. But we have had the best. Having said that, if we look at how health has changed and how it's become of paramount importance just in 6 months' time, the whole acceptance of what used to be, I have a cough and cold, I'm not going anywhere with it, it's okay, I'm part of a family, it doesn't matter, I am looking after my loved ones, I'm going to work, I'm not going to shake hands, I will still touch my computer, it doesn't matter. My teacup can be along with the rest. Nothing makes a difference. Today, if you have 100 fever, I have gone to office when I've had 104 fever. And nobody even asked me, you look flushed, are you sick? They might just say, why don't you go home? You look terrible. But from there, 100 fever, which we used to ignore, has become important. It has
Absolutely.
become paranoid. People with a cold, people who have sniffled and not done this, I'm like, apna manners kahan gaya?
Very
Karo.
interesting. Very interesting. Uma, so essentially it's a paradigm shift. I mean, if we just even begin with, what you started with, remember earlier when somebody wasn't able to reach somewhere and they said, "Nee, I had a viral here." And others would say, "ठीक है, viral है तो क्या हुआ यार? Come on, yeah, nothing. It's all right." Now, anyway, first of all, nobody says I have a viral. They said, "No, nothing." He says that, some allergy, all that. And secondly, if someone, so the entire jokes apart, what we are really getting is that there has been a paradigm shift um, in how we are approaching health. Now,
Yes.
the thing that I'm wondering, and just to set the ball rolling, clearly there is a paradigm shift. But is there also is there fear which is driving this paradigm shift, and what will happen if this fear goes away?
Of course, there is fear. And it has two ends of this. There are some that are really fearful, and some that have thrown caution to the winds and said it doesn't matter.
Yeah. So here is something which, I mean, like, to put the question in perspective. Health then, just before March, and health now.
So if you look
coming
at
to
it,
the centerpiece. It is coming to the centerpiece of our
yes,
conversation for business, for life,
right.
day-to-day life, how schools are going to be run, how education is going to be done, how careers are going to be followed. What do you want to begin with to set the ball rolling? What has shifted between then and now, as far as the health in life is concerned?
See, always we are driven by our notion of control or the lack of it.
Right.
And currently, what we are seeing, which is very different in the last 3 months or 4 months, is the lack of it.
Okay.
We have no control over who is an asymptomatic carrier. Or not.
Okay, you're frozen. Yeah. Okay. Yeah.
And how am I going to work around this?
Got it. So essentially, we will have to find our way around it, Uma.
Yes.
Because this is the unseen, right?
Yes.
This is the unseen. Earlier, it was supposed to be, I'm fine, I'm unwell, and I'm fine. I will not be scared. But the question here is what is coming up again and again for me. We are going to be, what is our work ethic going to be with Corona around?
It's a dramatic change. And I would put my own example of having worked for 33 plus years. I'm almost 35 years in the workforce.
Got it.
And for me, for most of my life, I have been on a plane every week. Or if not more than once every week.
Sure.
I have never stayed and worked from home. So I had to first set up a desk at home to see what was happening. And if I cut it across and look at healthcare space alone, the digital work is working well. The digital world is working well from home because they've had offers and they've also had regions which they work across. So they used to take their work home and they used to work from home. So it is not new to them. New to them. New to them. But if you look at the healthcare, the hospital world has changed for good forever. The individual healthcare consumption needs, including people with cancer, did not go for the first 1.5 months to get their treatments, including their chemos because of the lockdown.
Sure.
That changed. That's a huge shift from cardiovascular disease, name it, hypertension, diabetes, cancer care, and all those that are the non-communicable diseases, as we call it in public health.
They have had to take a hit.
They have had to take a hit.
In terms
we've had to deal with people at home who are suffering but cannot go because of the fear of corona also.
Sure.
Because we don't know what's going to happen.
So facilities are there, yet we cannot approach it. All right. Now this brings it to this is going to impact. So it's not just a question of, are hospitals there? Are things available? Yes, there are, and yet there is a fear. Now here is what I really want to kind of pick your brains on. The world will continue, right? World is not going to
Yes.
stop, and
No.
and for a while, as you told me, the vaccination is not going to be there.
No.
All right. So in that kind of a scenario, what's going to happen is that, just imagine, before any major crisis, for example, airports looked very differently 15 years back than they do now. So many things have changed so much over the years. So will certain things come in here? For example, one thing which comes to my mind is that in the Far East, a whole lot of things, how people started behaving before, what they used to behave before SARS and after SARS, there's been a huge shift. How face masks are now a part of their life over the last so many years now. What are the systemic changes you think will now slowly start seeping into day-to-day life, where we will continue in spite of COVID-19?
If you look at it, it's again an interesting public health perspective that I'm going to share.
Mm-hmm.
Systems are right now more held by the governance, and we saw something that the world had never seen. A lockdown of a length of the kind that we saw, and the number of people that actually adhere to the lockdown. So there's a behavioral change right there. The first thing that you see is that the day on 22nd of March, when we were asked to stay home for one day, I don't think anybody actually made the effort to go out. So how much of a mindset change is that? From being somebody who's out there all the time, we were in pubs, we were in hotels, we were in restaurants, we were eating out, we were going, we had movies. Entertainment had changed.
And we said that we cannot live without it.
Yes.
Yeah.
And the consumerism that was consuming us.
Sure.
And I'm going to ask you, Ashish.
Yeah.
I think your industry has been hit large.
Absolutely. Completely shut down.
Yeah. And how are they dealing with it?
So in fact, this question is from that entire thing, that the work will have to continue. There is no other way. Yeah. See, I mean, just, if you go into a cave hoping that it's not going to catch you, how are you going to earn? So that's a question which is true of, any industry, including the film industry, including any industry. You can pick up any industry. So we definitely have to be at work. The question here, and what we are dealing with again, is that everybody is discovering how best to put things in place. So one of my ideas of interacting with you is to also discover what are the things that we need to put in place. For example, I'm told that from 20th July, we again begin shooting. I'm told. I was giving a sense. So in that case, they put some stipulation, how many people are in the studio, okay? And then face mask being there, all those things are there. Separate, they're going to make sure things are separate, things are far. But what's interesting and what's also challenging, Uma, which I've felt across industries, is that we still don't know what's going to work and what's not going to work. All right. And what's your take on this? Can we ever be over careful in this, or can we actually go that, let's see what happens? Can we find our way through this? Can we depend on the herd immunity to develop?
Interesting. I'll tell you why. Because if you looked at some of the large reports that came out in the short period after COVID, the PricewaterhouseCoopers, the various bodies, Deloitte, all these people have been bringing out reports, and with the public health perspective. So if you looked at those, the economic numbers and the fear for economic impact is much larger than the fear for health impact.
Absolutely.
So if you look at it, paramount everywhere across board, people are worried about jobs and only then worried about health. But they know that without that focus for health, that job will have absolutely no meaning. So somebody just, I was talking about herd immunity, and I will tell you a little more about it. Somebody just asked me, Uma, I said, I'm dying to go back to work. Typical, हम लोग का जो conversation होते रहता है कि ऐसे नहीं वैसे नहीं ऐसे, हाँ. तो he said, अभी भी काम तो कर रही हो? He said, हाँ. I said, अब वो तो सुबह 6 से, आप तो ज्यादा काम कर रहे हैं. आज सुबह 6 से काम किए, हम रात को 11 बजे तक काम कर रहे हैं. अभी कभी खत्म ही नहीं होता है. जब देखो उठे रहते हैं तो वो लैपटॉप दिख जाता है. So he said, yeah. So काम की बात नहीं है तो क्या है? So I told him, I said, listen, the fact that we used to go to office has a whole industry around it. The real estate is hit and bad. Okay. There is so many other people who used to go to a hospital just because they had a cold. They won't go. Forget the serious ones. Those will still have to go somehow or the other. So some people who are old used to go to see their doctor to have a conversation. And I used to have a lot of people who used to come and say, aapse baat karke acha lagta hai. So they would dress up and come just to have a conversation with me. Okay, that's fine. That's also gone. I said, आज क्या हो रहा है? Herd immunity is when 55% of your population has it. So he said, I said, I'm in no rush to get the virus. While we all might end up getting it in some form, the delay on getting it, if I get it 4 months from now, we might be closer to a drug or a vaccine.
Sure.
I might have improved my immunity staying home and taking care of all these new advertisements that are coming up, the new brands that are coming up and saying, please take this will improve your immunity. And suddenly there is a shift from take this pill for this to take this for immunity. So you see an industry shift over there. There's a brand shift over there. And also if you look at it, the herd immunity is something that will happen maybe over time. But the farther you push out the fact that you might get it, the better chance you have of recovery. So that's a big message. That's a big
essentially
message.
Essentially what you're saying is that don't count on that possible herd community to kind of cover up for you.
No,
you know,
don't count on it.
Essentially, yes. So I got that. Okay. And so I'm not counting on that. So I'm taking care of myself and I'm very clear that I need to work. So therefore, the workspace, which is agnostic of any industry, each workspace will now probably need to have certain systemic things put in place.
Yes.
Which will have other than just to deliver things, but also to have health as a prime thing. So what are the systemic changes do you think that will need to be incorporated across industries?
So again, coming from a public health space, if you looked at it, the conditions like diarrhea, malaria, all these infectious conditions have stayed with us. SARS, dengue, have stayed with us for a while. And World Health Organization tried very hard to imbibe the culture of hand wash and hand hygiene and the 20-minute, way in which you actually do the hand wash, right? It did. Did we manage to convince a lot of people? No. Today, even your house help will not walk into your house without washing her hands straight at the sink because she's worried about whether she's getting it from you. So the kind of hygiene that is now taking place is not something you've ever seen before, and that will stay. That is something that's not going to go. That will stay.
That's my question to you. Yeah, because I kind of sometimes I do believe, and yes, I would want certain things to stay. But if you look at it, washing your hands even before a WHO circular would have come was something which was part of our culture. We would not just
Yes.
wash our hands; we would bathe at the end of the day, at the beginning of the day, at the earliest point of the day. And so often one used to bathe just to cleanse oneself or to wash one's hands. All those things, and wash the face, wash the eyes. But after a while, it didn't work out. It wasn't so. Lifestyle took over. My question here is, Uma, that at this present moment, yes, the scare is there. We are willing to do everything that is required, even do the namaste, because I just want to stay safe. As you said, it's the fear of that getting that contagion. But I personally feel that certain things will need to be systemic for it to be sustained.
Mhm.
Where businesses, and I put a special emphasis on business, because business is something which all of us are involved in. We could even be working in an organization, but business is something which is about people going out and offering their services. All right, I'm not talking of just people who can remain at home, but people who are going out to offer their services or even avail of other services that people are offering. There is going to be a major shift. And what are the systemic things that you think are going to come in place?
Several actually, not one.
Hmm. Mhm.
Contactless services will be one thing that will be a big thing.
Got it. Contactless service. Okay, got it.
People, I am very agnostic to digital acceptance of banking, payments, this, that, and the other. And I would always want to go and have that personal connect with my bank and, sit across and have chai pilado types.
Now you don't have it. I don't want it.
No, I don't want it.
I don't.
Even if
I
you
don't
want
want.
me to come, I don't want to come.
I don't want
Right?
to go.
Okay. The second thing is the adoption of digital health and IoTs in health. Internet of Things will take over. The blood pressure
Explain.
monitors,
Explain this. Explain this.
the blood
Please.
pressure monitors that we used to
Okay.
keep कि घर में कोई बड़ा है कभी जरूरत पड़ेगा.
सभी लोग.
There's तो pulse oximeter. Okay.
Yeah.
Then if you look at iOS software systems, which is Apple, has a device for you touch it, you have pulse, you have ECG. So there's a software app that actually takes care of you and tells you if there's something alarming towards a heart attack. So that is another Internet of Things. So if you look at it, there will be so many such apps that will take over. So the digital world will start becoming a very much a part of your intimate part of your world. So the security there is something that I will be worried about.
Yes. And also another thing. Uma, can you move a little to your right? Yes. Thank
Yeah.
you so very much. So
Yeah.
the other thing that I've seen, for example, do you remember that particular site in which you can diagnose if you're unwell? There's a particular site. Um, you put in your symptoms, it also tells you what you have. And I know of quite a few people who so often use it that they seem to they psych themselves into feeling unwell. And I'm just wondering, in fact, today itself, I saw a very interesting wristband. Amongst other things, prominently shown is the body temperature. So, are we going to get a lot of people who are going to get really caught up with, the hallucinations about, am I doing okay? I mean, do I have fever? Is that also going to come up with such a lot of digital thing available? Because yes, digital makes it accessible. But I don't think most of us have the ability to um, understand the data that is reading out to us. Will it increase fear? Will it make some more people feel that yes, I could diagnose it and I don't think it is, or I think it is?
So again, if I look at it, I look at it from industry perspective, public health perspective. Okay.
Please.
If you look at it from industry perspective, industry will say they will still come to us.
Got it. Will they say that?
because people who are paranoid and hypochondriacs don't care about COVID. They will still have to go and see the doctor. Then there are some who will fall in the foolish brave category, who will say,
Foolish brave.
COVID, yeah. They'll say, I am very brave. Nothing can happen to me. I'm going to go there. I'm going to get seen. It doesn't matter.
Got it.
So how are they going to deal with that? They will still continue to battle with things which they think they can overcome because of their bravado, if nothing else. Bravado. Okay. There is a conservative, perspective to certain people, and there is an intellectual perspective to certain people. So these two will follow the public health norms and look for what are my outliers, what is my chance that I should get it. In the last 3 months, I've had 100 fever more than 3 times in the last 3 months. Okay. Did that drive me to a hospital? No. It drove me to a teleconsultation? Yes. So the digital divide will take over. The doctor will ask you for symptoms. And of course, there is the Google uncle or the Google aunt, as we would call it, which is also a doctor.
Sure.
In more sense than many. For most people, more than any. But what will happen is, if you look at it today, for the last 4 years or 5 years, people had been talking to the government and asking for digital health platforms as an acceptance, because a large part of the mushrooming industry in health, as I would call it, was in new apps, in new devices, in new enabling surfaces for helping bring down the numbers in healthcare. Today we have the National Health Digital Blueprint ready, and it didn't take 3 months, and it had 100 experts. Today we have a Niti Aayog report, which actually talks about how we are going to take forward India into the next, future of how we are going to consume health. The PMJY, which came in 2 years ago, which is unique, which has 50 crore people insured, is now looking to see how actually there could be a COVID insurance for people, so that even those people that can't afford to pay can be a part of the bracket and can afford healthcare, good healthcare in good places. They're also looking to see, as part of the Niti Aayog, how we can have diagnostic industry be included, so that the testing doesn't become an impediment to making sure that you know whether you're positive or negative, and you're not waiting for people to consume help.
Got it.
So
that's a very
lots of changes.
Couple of things you have said, where you use this term consuming health. Now that is at one point I want to hold and get back to you on this. The other thing that I mean is that somewhere there is a whole lot of industry which is ready to provide services such that the hospitals are only dealing with people who actually need it. So would this also be a time that a whole lot of people are actually consuming products which are health centric? And probably at this point, the hypochondriac is not a bad idea to be, because what earlier considered something that what are you getting paranoid about could be a valid reason for you to get concerned about. And probably if we have right at homes, for example, I am hearing of these oximeters coming in. So at least if a lot of people who can be using this, at least the facilities in hospitals will be left for people who may not be able to afford other things. So in a way, do you think that this digital industry would help stop having too many people even reaching the hospices if they can deal with their things much ahead of time? And some who really need it will reach there, because just imagine this scenario that already our healthcare system wasn't very high up, in how it should be. But consider in this point, if a lot of these digital players come in, and we are having tests which allow people to have a little bit more confidence in them, then probably And as you said, something which happens over the telephone over your doctor could also go, so that the healthcare facilities are not strained. Do you think somewhere like this a coupling would come in, which would allow in these pandemic moments for things to surface?
It is already happening as we speak. Because if you look at the startup ecosystem for health, which every industry has a startup ecosystem for, the integration of technology to support health is one of the highest, whether it is artificial intelligence or it is robotics or it is data mining and data, sifting to give us numbers to the pharmaceutical industry as to what we need. So the industry perspective, as you speak today, is combining several industries across to provide the best that we can for health. So there's pharma industry working on one end, which is about working to see how we can actually get this vaccine or a health drug out at the earliest.
Yes.
Do you think this is the last of the pandemics? No. We have actually seen it slowly build up, and nobody expected us to be hit the way we have across the globe. So it's taken us by surprise. So what will happen if at all there is another pandemic, and if we have an vaccine and if we have a drug, is that we will look to be better equipped for the next one. If you looked at the SARS and the H1N1 or the swine flu that happened and how Kerala actually fought it versus how Dubai fought Ebola.
Yep.
So those people are better prepared to handle this kind of a pandemic than we were, or the US was, or the Europe was.
Here's a very interesting one. Very interesting one. In HBR, I was reading an article where they're saying that how by reverse understanding how countries who have been dealing with this, countries who are not very big, they had very few resources, but they actually found novel methods to deal with things which were localized, which are huge issues but were localized. But what you said, something is very interesting, that if we can have that kind of data mining available. So we are very clear. So a few years back, there was this very interesting snippet available of Barack Obama speaking of, I think at least 5 years back, that there may be an airborne disease which could come up. And how ready, how prepared are we to face it? All right. Now, it was still in the zone of hyperbole. It was a sense, could be, is this Hollywood playing up? Are they trying to create a contagion kind of a thing? So consider that the learnings of this period, as I see it, consider this is not just for COVID.
No, it's not.
The systemic thing that I'm talking of is, it'll not just be a knee jerk to this, but also looking at, and even beyond this. And here is another thing, and I want to ask you on this, and that's something which I've been wondering. Just look at the other side of it. This crisis impacted that a lot of people have not been traveling, okay? And we've been managing something, and some people need to travel. All right, now consider for a moment, can we also incorporate certain learnings from this crisis which go beyond the immediate knee-jerk of this COVID crisis, and now include that societally and support organizations and support governments to have them built in to our regulations? And I hate the word regulations, but still, in terms of the systemic thing, to have it part ingrained in us.
Yes, we definitely have a multi-sectoral approach to this. If you looked at how the hotel industry doubled up right away to help those people who were traveling, coming off long flights, who needed isolation, they geared up immediately for that. And they were people who offered the government and said, how are we going to be able to help those people? Because they can't go home. They need isolation. They need quarantine. So hotel industry rose to it. The insurance industry rose to it and said, can I have something which is in terms of industry specific for how we deal with people who are losing their loved ones like that? It's not an age, it's not something that you predicted, but there are people that go into this vortex. The first 2 months, we didn't even know what hit us, and so many people lost loved ones. So there are so many people who are dealing with crisis on their hands without having ever experienced a crisis before, because we are a post World War, post independence bunch of people that have had it well so far in life. And we've seen progress.
We are the pre-COVID. We are the pre-COVID generation.
Yes.
And we never knew something like this. And therefore, it kind of also brings to me that imagine the medical fraternity, Uma, the medical fraternity which is at the forefront of it. The health experts are dealing with something which they did not study about. And
Yes.
they don't even know what may cause or could cause. Imagine they are at the forefront. They are, it's a bit like the test pilots who are in they are on the mission, and they are testing it while on job. And imagine, I mean, the irony of that is never lost on me, that imagine the kind of reaction that people have had when there have been doctors around them, and how scared people have been of doctors. And isn't that painful, that how those people have been dealing with that? They've been at the forefront of trying to do things which no one has ever done before, and they are sworn to uh, their promise that they made. And imagine people are reacting in a particular way.
So let me give you a bit on the human resource side of it and how people in public health have dealt with it. Okay. Mm-hmm. So if you look at it, the government never stopped working. Every day, everybody, in spite of being where they were, whether it was lockdown or not, were mostly in offices. And those that were out in the field looking for contact tracing, especially in the initial days, where testing was not being done, but contact tracing was very high. So you had a whole field of people that were out there. Then you had hospitals that were meant for testing, meant for isolation, meant for treatment. So there was another treatment at that level for the public health. I'm talking again now, switch it to the private health. And in both places, those people that went there every day were ready to understand that they might be COVID. I have 6 children. All of them are doctors. All of them are in hospitals. They're all in COVID scenarios providing health. There has come a point where, since they wear PPEs, this is all getting cut because the quality of PPEs provided are not great. That is another thing. The other thing that happened is, pehle Bhagwan hota tha. Any god was also a doctor. We used to say, he saved my life, he's like God. Then the other extreme happened. When somebody died, they started beating up the doctor. So there were so many instances of violence that happened. And we really don't know what that behavioral shift happens with so many people locked down, so many people inside for so many days, so many of us having so many emotions running deep, so many, losing people. It's amazing how people actually have made that shift. But who did they take it out on? They took it out on the doctors, the medical health professionals, who are actually looking after them. This is something that's completely unprecedented. It has never happened before in the history where we have looked up to our doctors like gods. World over. World over.
And if we just look at it, and we just kind of just want to go into this, it's something to do with mental health, Uma.
Yes.
Because in this period, we have also seen a lot of increase in abuse. All right,
Yes.
and we know about it. So for me, when I look at people venting their anger at people, so to say, at random, I very clearly see a connect with their anger and upset with themselves. There is something wrong with them inside. Do you think that this is actually, it's much like a, what is that PSTD, well, a post trauma, what is
Trauma
that?
stress disorder. Post
Yes,
trauma stress
post
disorder.
stress, yeah, post
Trauma
stress and
stress
trauma
disorder.
disorder.
Yeah.
Okay, which used to happen during war times, and people are being trained for that. They get counseling for that. Do you think that apart from immediate health, what we say is COVID and all those things, and taking care of washing your hands, isn't this also a time that people have to start looking into the toll that this has already taken on the mental health of people?
So I'm going
Because
to go back and talk to you about workspaces and confined workspaces. And in workspaces, in confined workspaces, you've always seen that there is some kind of a little balance that goes away. Okay.
okay,
And if you looked at it, we had, Posh Act that came in for one kind of people. Then we had a counseling settle that got set up for another kind of people. Then we had the bosses, which used to do mentoring for a different kind of people. So there were multiple layers of things that actually happened in a workspace or an environment where we went outside of home. Look at what happened. And let me be honest, even as a woman, I used to employ a lot of women across the industry. And one question I would ask them, घर में सब अच्छा है क्यों आती हो काम पे सदर से घर में सब अच्छा है तो काम पे क्यों आऊंगी 10 घंटे तो यहाँ पे हमको अपनी रानी बनने का चांस मिलता है so they wanted to be the queens of their lives while at work, find an identity, look for places that actually gave them their freedom to speak their mind. And this is not for women alone. I can say it for men too. It is gender agnostic today that you actually see that. Of course, women get highlighted more and men less, but it is gender. There is no gender bias on that. But if you look at what happens now, there are maybe 4 people in a home, there are 6 people in a home, there is an in law factor in a home. There could be so many dynamics that are playing out. So, do you know they started something called the red dot movement?
yep.
If you're being abused in the house and you cannot walk away, please remember that if you have a red dot on your hand, I'm going to identify you.
Got
So,
it.
this is how difficult it has become to have closed, confined spaces where you have no vent. You're not being
Sure.
able to let out. I am running into the kitchen making chapatis if somebody wants me to make them. I am pandering to a 5 set of different times of meals, which I used to make sure that I was cooked and left on the table and people used to eat, and now they expect to serve it. And why? Because I'm available at home.
Sure.
And I have timelines to meet, just like my boss would expect it, whether I'm working from home or not. Is that behavior not going to change? I'm going to ask you a question, Ashish. Look at the leadership, and you deal a lot with the leadership across places, right? Different industries, whether it's in your film industry or outside of it, and you do so much coaching across so many places. If you looked at the top leadership and their expectations, have they been reset? Is the middle management's expectations been reset?
So,
If you
here is an interesting one, and that's I kind of um, there is a lot of double speak happening in the world always. There is a certain things that which are acceptable, and a lot of people who are heard. People want to hear acceptable things, and one of the reasons that I engage in conversations like this is that for us to actually even speak of the unspeakable things which are not expected, but they are there. So this question of yours is very interesting because the absolute top leadership will have a certain commitment as to how they would want to, very close to their ethos, very close to their upbringing, their worldview of life. Now, as we drop down, as we taper it down, especially like in a country like India where there are so many people involved, just the amount of time that each one of them will have to keep coaching people into new way of being, which is required, that probably diminishes because the needs and the wants of the organization at one end is the bottom line. And it can be anywhere, not just a private organization, anywhere, is for the organization to deliver. And how does the organization deliver? It delivers when people individually are delivering. And as we go drop down that pyramid, I really feel that if there is not continuous and over communication there, in the absence of over communication, people will be giving up, saying that you have no idea what we are dealing with. And for me, the biggest loss of this moment, and I was reading this article today, is that there is something called lockdown. And what we are seeing in the US at this point is that, uh, the quickness of which they were reopening, they have again have to shut down. Florida and all those places are, because probably the gains which could have been made have been lost by a quicker reopening. Now, it's also true in parts of India. Now, that is where we will have to be. That's why I think that the public health and organizational health and business health and the economy of the country, somehow those links have to be so clearly established that if it is pushed beyond, and therefore I'm saying that at one end somebody may be looked down as a wimp for 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 not going out. At the other end, probably that guy is somebody who is the key factor and who says that, hey, listen, I need to live, I need to survive this point, because it is not just a question of a very solo thing, because I get that experience all the time. The point here is that even though we may be in a metropolis living, all right, and the best hospitals around, but those hospitals do not have the beds. Okay, now this, we are now getting an experience what people at large have been getting. Now that fear somewhere will have to be taken care of, because if we are stepping out, we are opening ourselves up to scenarios, and people right at the top and here know that. And that balance has to be maintained. And seriously, this is the time of innovation. This is the time where each one of us has to understand and see ourselves as people who are stepping into this new world for the very first time. We are the first, the last of the pre-COVID generation, and we will be making our mistakes. My question here is, of all those things that we think we should be applying now, don't you think that we should also be applying things which people may think are completely wrong, but we believe in?
I do agree, 100% agree. So if you look at it from what I hear from you, and what is very common in public health is the strong communication that needs to go out, the training needs that need to increase, the kind of public messaging that needs to be there can
Which
only
people have
be
to
strong.
believe in.
Yeah,
Yeah,
and
because
can
they're not
only be
ordered.
stronger. They can only be
Yeah,
stronger, not lessened. Because I'll
yeah,
find a lot of the corporates, if I look at it, will start going into conscious consumption or conscious spending, as I would call it.
sure.
And we are doing this as people at home. We are looking at conscious consumption even at home. The
Yeah.
luxury is something which has found a new definition. Is there the mask that's coming out, which can be worn only like this by a Louis Vuitton? Yes, it has already come. There's a
Already,
whole
yes.
bunch of, yes, there's a whole bunch of glitzy gold masks because people cannot wear jewelry and go anywhere. They might as well wear a mask and go somewhere. So if you do see that conscious consumption that's taking place today has changed. And if you look at it, the limiting of waste of food, the restaurants not being making anything unless there is a takeaway order of some kind. The if you're looking at buying options and standardizing those, brands have changed. The new Gillette ad has changed. You actually look at the way the whole industry is adapting. So it's
Adapting, and that's the thing that I want to say. I personally don't think this is just for this period. You see, for me, marketing and storytelling will evolve as time goes past. All right, so it is like an evolving story. But the question that I had is that if the leadership has to communicate this urgent story,
Yes.
The COVID thing is like a systemic thing for me. It has to, if we do not learn from this, then we are just opening ourselves up to more issues, more variations of COVID which may come up. But this, I think, is a golden opportunity that if the communication is, people are, if I may say, investing, that people get it. It's not that karna padega. It is like I choose to do it for these reasons and I get it. And personally, if people get it, that's when they apply it. Otherwise, they are only doing it when others are watching.
True. But a lot of people will get it this time, Ashish,
Yeah,
because what COVID has done is a unifier.
yeah,
It's a huge unifier. There is no rich, there is no poor, there is no any kind of religion, there is no politics. Have you seen for the first 2 months of COVID, there was no other discussion till China came up.
yeah.
So if you looked at it, the challenges in organizations that we saw were not about anything other than making sure that they faced the need to understand what was important, what was systemic, and what would stay. So
Super.
if you ask me, healthcare has gone from outpatient care now. There is no longer outpatient surgery, aaya karaya chala gaya. So 20 saal pehle, the 20 years ago where people used to come, they had to stay in a hospital. So that number will now, where we thought, we have an overcapacity of beds. Hospitals are too large. Today, they're not enough. Look at Bombay, the way they had to convert stadiums, and they did it so beautifully overnight. Look at China, the way they converted. Look at Korea, how they actually isolated. Look at Singapore. You have global examples.
What they have done in Delhi yesterday was
Yes.
reading about it. An entire thing is being created. Yeah,
Yes.
fantastic.
Yes.
Yeah.
And we are only able to do that because we are in this generation. 20 years ago, we would not have been able to do it.
Sure.
So we are dealing with different circumstances. Those circumstances, I hope, don't become scars, but they will stay and make us adhere to systems in hygiene, systems in healthcare, systems in spending, systems and outcomes of how we are viewing other people versus ourselves.
Wow.
There will be so many changes. So many
So
changes.
this conversation for me is a conversation of discovery, because living forward, uh, we were to be responsible for everything that is there. In any case, we are responsible. And for me, therefore, I've personally felt that not just to do it because you're doing it, but if we get the why of it, if we really get the reason why we are in it, and if we can communicate that powerfully with people, that's when people start adhering to it. Otherwise, they're just obeying it, and people don't obey for too long. And very beautifully put by you, Ma, when you spoke of the learnings, the systemic learnings, and if they seep into our DNA, and if we are left richer with this, it's a ironical word, but if we are left richer with this experience, that we become more stoic about things rather than callous. And if we get to balance and create value amidst all this, and if this is now part of the deal, part of the things that people say, yes, this has to be dealt with, this is part of the cost, this is a need, and I think that is where we'll really take steps ahead. And probably in the future, the knee jerk will not be needed, because we would have certain things in place. And as you very beautifully said, that even our expenditure, what we are spending in, probably a part of it, or probably a large part of it, even for organizations and governments, would go in some pockets which they earlier did not go in, which I think definitely, in terms of health, what is needed for the health of people, of their extended family, their mental health, their capacity to handle stress, and the new variations of that. So some very, very interesting comments are coming up. And this is Asmita Bhattacharya who writes, creating psychological safety in communities, organizations, institutions will be critical, and leaders at all levels will need to drive this. Your take on this as we are into this last 5 minutes of this conversation, very rich conversation.
So, psychological safety is already being reviewed across boards by large organizations, because they know that they have a few thousand people workforce running into hundreds of thousands somewhere across the globe, where they will have helplines that will come in to make critical decisions, and they will ask people to talk to them for psychological relief. Because if you look at it, otherwise the suicide rate will become higher, this abuse will become this thing, that will become a norm, robbery and daylight robbery will become something.
Yeah, and people feeling low,
isolated,
were around and just feeling low and sapped. And I see that if we do not, and let me rephrase that question. I think this is really an opportunity for us to preempt. We are there when people are needing it, rather than
absolutely,
first people needing it and then present. So really, thank you so very much, Uma. I know you are a reluctant person to kind of come on such fora. I really appreciate the fact that you accepted my invite. I really, really appreciate.
thank you.
I'm touched by your commitment towards your work. I'm also touched by your humanity, and there are so many aspects about you which I feel so grateful that I just know you. Um, I'm so very happy that you made time to be here with all of us today. There are a lot of people who know you, who are here, who are saying such wonderful things about you, and what they have gathered. And I'll request you to come on and have a look at the comments on LinkedIn and Facebook, etc. And if you can respond to them, that'll be wonderful. And dear friends, if you have any questions that you may still have, that you may want to ask Uma, you may send out to her on LinkedIn or send out to me. I will forward it to her. And thank you so much for being here today. This is going to be an ongoing conversation for each one of us, because we are very, very clear that this is going to be here for a while, and how we are in the face of it, not just as a knee jerk, but how we are in continuing in the face of it, is going to define how we are with the world. This is really an opportunity for us to not just to deal with it as a medical emergency, but also an emotional emergency. So let's be kind to people around us, people who may not be even, they might not have tested positive, but they are going through stuff. So this is a conversation around health in life. And thank you, Uma, for having illuminated so beautifully.
Ashish, can I get one word in before we close?
You got all the time, my dear friend. I'm through with it. I've said my thanks. Now it's over to you.
There are a couple of people who will understand what I say when I say it. It's like when you say I'm a reluctant speaker, I'm very shy. So that's where I come from. So that's a behavioral aspect that many people don't see. And has that been brought out during COVID? Yes, it has. And am I going to be able to do this? Maybe a little better, thanks to Ashish and his continuous reinforcement in me that I am able to speak and that I should be able to share some of what I have with all of you. So I am grateful to Ashish for his persistence. I am grateful to each of you who has been here on this 1 hour call and heard us speak, because it is as much about you as it is about anybody else. I'm also grateful to technology that is making this happen, and all those people behind Ashish in the scenes, and all the digital world that is actually making this possible for us to meet. I am making new friends. I was on a a seminar in Singapore for a week, starting 5:30 a.m. without knowing who it was. And there were 7,000 people across the globe that were on that seminar. So we are grateful to find new friends. Thank you so much for being here, and thank you so much for making me a part of it.
Appreciate it. Thank you so much, everybody. It's well known. You have an extraordinary Sunday wherever you are. Uma Aysola, Zindagi Bandhu. As we say bye, as we say namaskar to everybody. That's going to be the new normal, right?
Yes.
So namaskar, everybody.